so excited to have Shasta Hickman with us again, licensed mental health counselor, and she is going to be helping us address the issue of obsessive-compulsive disorder, OCD. And I think that a lot of us have heard that term and maybe flippantly talked about it, about how, oh my gosh, so-and-so is, so organized and they have to have things just so, and so they're totally OCD. They have to, have things just right. And I think maybe we're doing, OCD a little bit of disservice. Maybe we're not getting it quite right. We're kind of diagnosing people incorrectly. So I would love for you to kind of say, what exactly is OCD, and how is that different from being very organized?
Yeah. So OCD is not just a series of behaviors, kind of as you described. It is an actual mental health diagnosis. And whenever we flippantly use a diagnosis as like to describe a behavior or a set of characteristics, we're sort of taking away from the seriousness of the, this is something that a person literally can't help.
Yeah.
That they are
choosing that behavior.
Yeah. They would never choose that behavior, I would say, most of them. So I like to think of diagnosis on a continuum. So there are characteristics that we might like jump to say are OCD. Yeah. And so I like to use the thinking about some of those characteristics on one end of the continuum and the diagnosis on the other. Okay. And so OCD is heavy in thinking and doing, right? When we think about OCD behaviors, it's thinking and doing. And that also describes somebody who might be a type A personality, right?
Yes.
Yeah. So I like to use the example of the highly productive attorney who uses reason and action to build and deliver their arguments in court, right? And they do a great job and they're really successful. And they're over here on this like thinking and doing end of the continuum. Yeah. And it serves them well. They make a great career and they get a lot of stuff done. They help a lot of people. It's a beautiful thing. So that's something we just want to embrace and even admire about somebody. Sure. And somebody with OCD might also have those same characteristics of being heavy on the thinking and doing side of things. And yet it somehow interferes with their life.
Okay.
Right?
Yeah, and I think that's a key theme that we're having with the diagnosis part of it is this is making your life more difficult. This is interrupting, your everyday functioning at work, at school, at home. That's kind of, I feel like that's the alarm bell that says, ooh, something is not working here.
Yeah. So sometimes OCD symptoms include perfectionism, but it's not just, I really want to get an A. It is interfering with completing tasks.
Okay.
It might be a preoccupation with details, inflexibility, and interpersonal control. So wanting to control things in relationships. And, so much of that is about feeling safe and secure, and it's about attachment and how as humans we have this innate need to feel safety and security. And we literally have a need for safety and security. Right. Like we need to be able to.
That's a good thing. That's not a bad thing. Right.
Yeah, exactly. And so when things get out of balance, right, when that gets to be so big that it interferes with functioning in life, then, it's time to call in some professionals and get some help to put you back on the other end of the continuum in that like high achieving end of the continuum where you're thinking and doing and you're using those gifts that you have to be able to accomplish the things that you want to accomplish in life.
Right. So that it's not weighing you down
and
preventing you from accomplishing what you want to accomplish. I think that's a really great way to put it. And I've always been curious about this. How does biology maybe factor into it? Is it something that if you had a family member that struggled with this, would, would there be a potential that you would be more likely to develop that, or?
Sure. Yeah. And there's always going to be the argument about nature versus nurture on that one, right?
Yeah.
So it's not unusual to see a child mirroring their parent with this diagnosis, right? So if they see their parent going over something over and over and over again, that's a learned behavior by their child because they see their parent doing it. And model it is a powerful tool in parenting.
Yeah.
And it goes,
that's the nurture part.
right. That's the nurture part. So sometimes we will see it in kids, especially when the parent has a diagnosis.
Yeah.
And there is biochemical, factors that go on. You may have a lower serotonin level inside your brain that would lend itself towards a diagnosis like OCD.
Okay, that makes sense.
Mm-hmm.
Yeah, there's so many factors, that attribute, to these different mental health diagnoses. But I think the important part is just to let go of the shame that sometimes comes with that, because it's really has nothing to do with some sort of performance that you need to come up with, or because you're not a good person, or that you've somehow fallen short. These things are false,
Yeah.
You are struggling with something that you, like we said before, like that you would never choose. And there is treatment. There is a way forward for you. And that's really the encouraging part. What would you say to someone who feels like, oh, if I just ignore these symptoms, it'll probably just get better eventually?
Oh man, that ignoring, that avoidance, like we talked about before with anxiety, it actually reinforces the behavior or the diagnosis. And so the more we avoid, the bigger the problem gets.
Okay.
And so I encourage you not to avoid or ignore.
Okay.
That would not be the solution.
Okay. Yes.
Yeah.
So how can people get some help for OCD? What's the pathway?
Yeah. So mental health counselors are qualified to help you assess if that's what's really going on.
Okay.
And they have tools to be able to do that, as do psychologists and, some other practitioners. But counselors can do it. They can help you assess if that's what's really going on. And that's the first step, is to figure out what's going on. And there are great therapies, like we talked about with anxiety. Cognitive behavior therapy is one of the researched methods that we can use to treat OCD. And I recommend that, you talk to your medical provider about the potential of taking an SSRI. Research shows that CBT in conjunction with an SSRI, which is medication that helps, restore your serotonin levels in your brain, are the best collaborative approach to treating OCD. And basically what it does is it allows you to refuel your serotonin levels in your brain so that you can tolerate the treatment. So you can go through the therapy. And it's the most efficient way to treat. Now, medication's not for everybody, and that's okay. You don't have to have medication. But I'm all about efficiency, if I'm going to be honest, right? Like I want to, soar through this treatment so I can feel better sooner.
Right?
Yeah.
Right. If there's a way to feel better sooner, I think most people are going to try to sign up for that. And I think that's an important thing to highlight, is that there is a serotonin deficiency with OCD, maybe a little bit different than other anxiety disorders. The intensity of it is different for each person, of course, because it's all in a continuum, like you said. But so important to really just offer that hope of treatment and knowing that you're not alone in this. There are people that can walk this journey with you. And so thank you so much, Shasta, for sharing all of this with us today. And we're just excited to see how people can get on that pathway to healing. So thanks again.
Thank you.
And to his heart for supporting this channel. If you want more information for you and those you love on mental health, go to mentalhealth.academy today.